Meanwhile, scientists are trying to figure out how best to fight and maybe even cure AIDS at the final day of the International AIDS Conference in Vienna. At the same time, there are people that are challenging the very conventional wisdom that those scientists are going off of. And earlier I spoke to one of them, John Lauritsen, and he says he's been slandered and ostracized for going against the norm.
I have been doing this now since 1985. I would say that the whole idea of AIDS is phony. It's a construct, but in no way a coherent disease. Whatever it is definitely not infectious. And that ever since the very beginning, we have a series of blunders, mistakes, and eventually lies, which have cost the lives of hundreds of thousands of people in the United States. It was not necessary. I've attended the AIDS conferences. Three of them, San Francisco, Berlin, and Geneva. And I did so as a working journalist for the New York Native. So I know very well what these conventions are like. It's all propaganda. It's all a trade show for the commodities of the AIDS industry. It has absolutely nothing to do with science. There are enormous profits involved, but they have been at the cost of human lives. In one single year, the profits from one single drug, AZT, had gross profits of $4.5 billion per year. And this is a drug I know very well because I exposed the fact that there was cheating, fraud in the phase 2 trials back in 1986. This is something people like to forget about. They like to say, oh, the reason AZT killed so many people because the dose was too high. That's absurd. It was a poison from the very beginning. It had no benefit whatever, and it was approved on the basis of fraud. The early AIDS cases, the first few years, were very sick. This was true of all of the AIDS cases. But from, say, 87 on, increasingly people are not sick at all when they get an HIV-positive diagnosis, which does not mean at all that they are infected with the virus. It's merely a positive result on a bogus test.
Well, then what explains why those initial people you're talking about died?
Heroin users got pneumonia for the same reason they did 100 years ago, because they used heroin. That's well known. Gay men got AIDS because they used a lot of different recreational drugs, including poppers or nitrate inhalants.
What about those that didn't use drugs? What about those that didn't use drugs?
That's what the AIDS establishment always likes to say, that. What about these people and so on? They lie. They make it up. The early AIDS cases had many health risks, venereal diseases, antibiotics, powerful psychological factors. Gay men were told they should die, and that's part of my talk. But the main thing were drugs, not only poppers, a whole lot of them.
But what about now? I mean, still, the majority of the 18,000 people who have died as a result of AIDS are homosexual men. I can't imagine they're all drug users.
Sure. Right now, perfectly healthy people can get an HIV-positive result on these bogus tests. Then they're told to extend their lives by taking AIDS drugs. These drugs are not as deadly as AZT was, but in the long run, they are certainly poisons. People are dying of the drugs, not of AIDS. They die before they get an AIDS diagnosis. And where I live, Massachusetts, the leading cause of death among people who are HIV positive is liver cancer caused by the AIDS drugs. Many of these people never live long enough to get AIDS.